This is a blend extra. 1 out of every 10 babies and kids will get this very common skin problem. It's called eczema. It causes a red, itchy rash. Today, a look at why it develops and why it sometimes becomes chronic. We're also going to help you talk about, or we're going to help you prevent and treat eczema. Dr. Eric Alexander is a board-certified dermatologist with Dermatology Associates of Wisconsin. Great to have you here. Thank you so much. Eczema, what is it exactly? It's common, and sometimes it goes away, and sometimes it's longer lasting, right?
Yeah, there are a number of types of eczema, but essentially they're all unified by having dry, red, itchy, irritated skin. And one of the most common types is what's called atopic dermatitis, which is frequently a childhood disease and starting usually in the first year of life. And you're absolutely right. Over time, it often gets better and can go away, but it has a tendency to kind of sneak back often in adulthood. So once someone has it, there's always kind of that tendency to have it. So it's always something that you might be dealing with.
And what causes it? Is it genetics then?
A lot of it is, yeah, and particularly for atopic dermatitis. It often runs in families. That being said, oftentimes a baby will show up with atopic dermatitis and there won't be a family history, but oftentimes whether it's eczema or the related diseases of asthma, hay fever, seasonal allergies, there'll be something like that in the family history.
I know when I had my kids, we'd sometimes call it baby acne. Is baby acne what really is actually eczema?
They're often a little different in terms of the true baby acne. It is exactly much more like an acne process, but they can mimic each other a little bit. So the face and the cheeks in particular is a very common place for eczema to show up.
Where else does it develop?
It can show up really anywhere. It can be all over the body, but in young babies tends to be on the face or the backs of the arms and the legs, and over time it tends to migrate a little bit and settle in places like the insides of the elbows, behind the knees, and on the neck.
Okay. What about, does it spread? Is it something that once you have it, it can actually spread?
Everyone's a little bit different. You can't do anything to cause it to spread on yourself, but it often will start out with a small patch, and then over time on its own, if not treated, it will just worsen. And it can get very severe, and we don't think of eczema as something that shortens your lifespan, affects your internal organs, or usually puts people in the hospital unless very severe. But take a more severe childhood illness like diabetes, and it's more disruptive to a family to have a child with bad eczema than it is diabetes, just because the child's itchy, they're uncomfortable all the time, the treatments are often a little bit more labor intensive. So in terms of a quality of life issue, it's really a big deal.
What about preventing it? Are there things that people can do, especially with young children or babies, to ward it off?
We don't have any cures for eczema, so again, once someone has this tendency, it can always show up, but there are absolutely things that can be done to try to minimize it and try to prevent sort of flare-ups of it. A lot of that has to do, in babies want good bathing habits, so every day or every other day is fine for bathing, but make sure they're not in there for too long, no more than 5 or 10 minutes. You don't want to use super hot water. Then after they get out of the bath, just pat them dry, and it's really important to keep the skin moist, because in eczema, one of the big problems is that the skin just doesn't retain moisture as normal skin does. So using good thick moisturizers like Vaseline petroleum jelly, something like that, right after you get out of the bathtub, and then a couple other times throughout the day. Minimizing overheating, using breathable fabrics like cotton instead of wool. Those can all be helpful.
And I know keeping their fingernails short too, so they don't aggravate
the problem. You've got to watch out for the scratching.
Is key. So if you have a child with eczema, a baby, or if you have it too, you can call Dermatology Associates at 1-855-DERM-WIS or go to dermwisconsin.com for an evaluation. Nice to have you here,
Thanks
Doctor.
for having me.
Thank you.